Hello.
Hi, what can I help you with?
I'm here to see what it is like to be an ER patient.
Okay, can I get your name and date of birth?
Yes, Emma Tuzicka.
Okay. And then are you coming from home?
Yes.
Okay, perfect. Okay, so I'm going to have you sign a few things.
Alrighty.
Okay, and then we'll get a bracelet printed out for you, and then let me call the nurse to come grab you.
Alrighty, thank you. Hey guys, it's a sunny day, but we are headed into the emergency room today. Nothing serious, thankfully, but just to kind of give you guys an inside look of what it looks like to be an ER patient. This is something that is kind of, it's one of those things where you're fight or flight, so your adrenaline's going to be going, you're not really going to be thinking about kind of necessarily what you're doing. So here's how to get you prepared, so maybe you have a little bit more of an idea of what to expect from when you come in, what to have to be prepared to make sure that you can get the care you need at the emergency room. Let's go.
Your nurse will be right out.
All right, thank you.
You're welcome.
Hi, is my patient Hannah?
Yes, it is.
Hi, you want to come with me?
Hello, yes, thank you.
Yeah. We'll come right into this room right here.
All right, thank you. And then Shari, do you mind if we take off masks and if I set this down so we can just have a conversation?
No, please, let's do. All right, Emma, as I said, so my name's Shari and I'm going to be your nurse, so what brings you to the ER today?
Hello, Shari. So I just wanted to see what it is like to be an ER patient here at SRMC.
Oh, perfect. Well, you came at a great time and I'd be happy to help you with that.
Perfect.
So, first of all, the ER is quite a different place than the clinic. You don't have to have an appointment to come to the ER. You can just show up. When you first come in the ER, you check into the desk that you were just at and they'll notify a nurse that you're here. So initially when you come into the ER, we start by doing a medical screening exam and a triage. And that consists of several different steps. One of those steps is vitals. That is something that is similar to the clinic that we do. Our monitors are a little different. They do make a lot more noise, and they're usually on you for a longer period of time. Vitals are usually something that's trended more in the ER. So we'll usually start by getting you hooked up to our monitors while we ask you a bunch of intake questions and do an assessment so we can determine what's going on with you and how severe your illness is.
Okay.
So one thing in the ER is patients are seen in the order of severity, not necessarily how they come in, because our goal is to intervene with anything that may be life-threatening and get the patient taken care of as quickly as possible.
Okay.
So through this intake process, that's kind of where we deem where you need to be seen at with our physician.
Okay.
So like I said, the first step is going to be our vital signs. And then we would talk. So first I would ask you your complaint. You would tell me why you were here. We'd kind of go over symptoms, how long it's been happening, other things that it's affecting. I would need to know any medications you're currently taking, any allergies that you have, and then I would do an assessment.
Okay.
And then, depending upon what that showed, like I said, I will go back and tell the provider what I found, and we determine, like, you're very, very sick and you need to be seen right now, or I'm going to go tell the provider, they're going to order some tests, we're going to see you, and we'll get going on the process.
Okay, and for those tests, typically, at the lab you wait, or you can get your labs done, you can leave, and then they'll give you a call about what your results are. Is that the same procedure here at the ER?
So the ER is a little bit different, and that's one reason an ER visit is longer. So when you come in, like I said, we do your assessment, the provider sees you, we determine everything you need to work up your condition, to either say you're safe to go and continue following up, or to get you feeling better, or to determine if you need to be admitted or transferred. So that process, the reason it's longer is if we order lab tests, we have to wait until they're back because a lot of our determination is built upon all of our tests. Like we have to wait for the whole picture. That's another thing that is different when you're in the ER too, is you're going to see lots of team members. It's not just going to be your doctor and nurse. If we do have labs, you might see one of the lab techs come in to draw your blood. If you have x-rays or a CT scan, you'll see a radiology tech. Or if you have EKGs, you might see a respiratory staff member that comes in to help you to either get the test or to give you a breathing treatment or something.
Okay.
So all of that stuff does take a while to get back.
Okay.
You don't get to leave and we call you because we want to make sure that you're safe and you have your results when you leave.
Okay.
The only time there would be an exception is if something is a send-out test, and then you would get a follow-up either with your physician to get those results, or you would get a call from an ER physician at a later time on that.
Okay, that makes sense. So that would be why there could often be more of a pause or break period of time in between coming with nurses coming in and out, or whether it's PAs, doctors. That's just all part of that process of getting tests and paperwork and all that stuff done.
Absolutely. So I kind of like to tell my patients when they first come in, ER is kind of hurry and wait. You get here, you have an emergency. That's why you came, is you feel like you cannot wait and be seen at a clinic or a walk-in clinic. So we need to get you taken care of. So we determine what level of emergency that is. So you see lots of people, we get all our tests, and then there's a wait period.
Okay.
And then everybody comes back in and follows up.
Okay.
Yeah.
And so what would be considered an emergency? Is that like everything, or?
So that question can be kind of difficult. Because you as a patient decide really what is an emergency. But
Okay.
things that we frequently see, reasons that you would be in the ER are like, especially for younger people, traumas. Like if you're involved in a car accident, or you have a fall or a laceration or a broken bone, those are all reasons people come in. Sometimes you're just really, really sick and you don't feel like you can wait to see a physician in the clinic.
Sure.
Or sometimes you may be go to the walk-in clinic or your regular physician and they deem that you need more intervention sooner than later, or they want tests back quicker than waiting on the outpatient. It's like, we need to know. So you would come over and we would start treating you right away.
Okay. And I guess what really my last question would be, what other tips would you have for teens or young adults who are coming into the ER for potentially their first time, whether it's with a parent or by themselves?
So I feel like the ER, first of all, the word ER is just scary. So know that everybody's goal is to take care of you, make you as comfortable as possible. There is lots of moving pieces. We do try to keep you informed at all times, like we're going to do this. Have you ever had an IV inserted? You know, so you can anticipate what's going to go on. But ask questions. If you're unfamiliar, if you're feeling scared, ask questions.
Okay.
And then, like I said, everything in the ER, it can change at the flow of the minute, because you may be here in the middle of a test and something emergent may come in by ambulance, and your team may have to work on that patient because they're really sick or critical.
Okay.
So sometimes the waiting game, it kind of goes back and forth,
Right,
you know?
right.
So sometimes it's not always good to be first in the ER.
Right, okay.
Yeah.
Well, I think that makes it pretty more clear to just Lella and me, so hopefully it'll help make a difference to anyone else who might be coming in for the first time. So
Yep.
Thank you very much, Shari, for talking with me today.
You're welcome. I hope your understanding's better and we can help more people feel comfortable should they ever be in this situation.
For more information, visit sydneyrmc.com/yourhealthmatters or call us at 308-254-5825.